Bună ziua și bine ați venit la acest nou webinar. Sunt Sorin Melenciuc, redactor șef al platformei 360medical.ro, iar tema acestui webinar este obstetrica ginecologia, o specialitate vastă dintr-un domeniu și mai amplu, cel al sănătății femeii. Un accent deosebit în cadrul acestui webinar va fi pus pe endometrioză, o afecțiune de care suferă un număr mare de femei din întreaga lume, dar și din România. Invitatul nostru în cadrul acestui webinar este reputatul profesor Fritz Nagele, director medical al Spitalului Goldenes Kreuz din Austria, care va răspunde la întrebările Veronicăi Procintescu. Veronica.
Mulțumesc frumos, Sorin. Hello, Professor. Thank you very much for being with us today and for taking your time. You have been medical director for 5 years and head of the obstetrics and gynecology department at the Goldenes Kreuz private hospital in Vienna for 15 years. Can you please tell us how has the clinic developed over time?
This clinic is located in the center of Vienna, and this also explains why it is a very beloved place by many specialists around in this area. And our story here started around 100 years ago, and in those days it was mainly obstetrics which was done in this hospital. In the meantime, which means over the last 100 years, naturally also all these specialists dealing with obstetrics started to do gynecology, which means up to date that today we cover all the wide field of gynecological surgery too, apart from being the biggest private obstetrics department in Austria.
I understand. What key areas of gynecology does the hospital cover?
Well, we cover more or less all the fields of gynecologic surgery. Main indications being naturally benign diseases, but it goes, we cover all necessary indications of gynecological diseases over all the years of a woman's life, starting with young ladies suffering, for instance, many of them, we speak later on about endometriosis, up to problems in later ages like incontinence, and in between also the variety of rare but also malignant diseases.
Let's start first of all to talk a bit about surgery in the field of gynecology, and let's please cover a bit what developments have been in this area in the past few years.
Well, over the last, I would say 2 or 3 decades, the field of gynecological surgery changed completely, which means that the majority of all operations we perform today are done minimally invasive, which means we don't open up the abdomen like before, but we treat the majority of diseases by so-called keyhole surgery, which means we have only very small incisions, some 5 millimeters or up to 1 centimeter, and up to 3 to 4 of them, which not only means a much better cosmetic result, but at the very end, recovery of patients is much, much quicker.
Now, today the focus not only lies on minimal invasive surgical access, but also on the preservation of organs and their functions. In which areas can this be better achieved today?
Yeah, this is a very good question. You know, when I started doing my training, the so-called hysterectomy, which means complete removal of the uterus, was a very, very common operation. While today it has become a very rare kind of surgery because we all try to preserve organs as long as it is for medical reasons good for the ladies. Best examples are, for instance, fibroids. Fibroids are very common. Almost every woman in the course of their life develops fibroids, and fibroids make different kinds of symptoms. Heavy bleeding, back pain, incontinence problems, and so on. And in older days, this was a typical indication for complete removal of the complete uterus. today we try to remove just the fibroids while preserving the uterus at the same time. And in this way, we solve the medical problem, while the lady can preserve the uterus. The same is with ovarian cysts, for instance. We don't remove the complete ovary, but we just remove the cyst and we preserve the ovaries.
I understand. Now, let's go a bit into endometriosis, which is, as my colleague Sorin said earlier, a condition affecting many women in across the world, but also in Romania. And it's possibly one of the main reasons women in Romania choose to come to your hospital in Vienna. Why is it still an enigmatic disease? And what is, let's say, a humane word, endometriosis?
Well, this is a very good term. It's from the States and from the English-speaking countries, the term enigmatic, which means exactly nobody knows why. And there are many theories why young ladies develop endometriosis. We know it's mainly in the cities. It's not on the countryside. It's 7 times higher inside the family, or with first related, if the mother had endometriosis and so on. So genetic reasons, environmental reasons, many reasons are responsible for this disease. But the point is, it's a very, very common disease, and it makes, in fact, 2 main problems. First, pain, and second, we very often find endometriosis in ladies which failed to get pregnant.
Yeah. Can you tell us a bit more about the symptoms and what women should be aware of when before choosing to come to the hospital? What are the specific signs?
The very main symptom is painful periods, which means dysmenorrhea. But the point is, dysmenorrhea is also a very common symptom in ladies which don't have endometriosis. Anyway, if the pain has a very high level, which means that the ladies must take tablets 3, 4, 5 times a day, and they really fear their next menstruation because they are unable even to leave the house because of pain, then this is the main symptom. Depending on the location of the endometriosis inside the lower pelvis, typical, if it's near the bladder or if it's near the bowel, it can also make urinary symptoms. It can make pain during opening the bowels. Yeah, this is the main. And if it's a more or less advanced form of disease, it's a continuous pain every day. Mm-hmm. And this is not very rare, because the typical thing is, if a young lady suffers from endometriosis and she tells her symptoms to her mother or to her doctor, he says, well, this is not a problem, just take the tablets. Or the mother says, don't worry, I also had pain during menstruation, this is normal. And this explains why usually up to 7 years, it takes up to 7 years until the correct diagnosis of this disease is made.
Actually, I wanted to speak a bit about how difficult it is to diagnose this disease. Most women find out they have endometriosis when they try to conceive. Can it be diagnosed before, like in the early years? Can it be seen early on, let's say from, I don't know, 18 to 20 years of age? Or when's the exact moment it can be best diagnosed, to be targeted, to be discovered, this disease?
Well, I think it's a very, very good question. It's very important that young ladies are aware of their body. They should really hear very close to their body, and they should not bear the pain they have every month for too long. To answer your question, unfortunately, there is only one thing, one clear diagnosis, one tool which allows it a clear diagnosis, and this is laparoscopy, which means all these other investigations like radiology, ultrasound, MRT, and so on, they are sometimes helpful. They can give tips, but they are unable to diagnose the disease. Diagnosis only is made by laparoscopy. You clearly see the disease and you can take specimens, and these specimens undergo for histological examination. And this is the only way that you can finally get the diagnosis.
So laparoscopic operation must absolutely always be performed before making a clear diagnosis?
Yes, yes.
And
but, but laparoscopy is not only the tool for diagnosis, but also at the same time to treat the disease.
I understand. Can we talk a bit about this intervention? What does it entail? How does it take place? Can we offer some details in this regard?
Usually it's, as we said before, minimal invasive. Minimal invasive is a term which only describes the excess. The excess is minimal, but the operation itself inside the abdomen can be huge. Can take hours if it's a very advanced stage of endometriosis. Anyway, the excess is minimal invasive. The operation is done under general anesthesia. If it's the earlier we can make the diagnosis, the better we can treat the disease. But of note, endometriosis is by any means a chronic disease, which means you never can be sure that it wouldn't come back again. But if it's a very advanced stage of endometriosis, ladies who suffer for 10 years until they get this operation, and they have blood on their stool, or they cannot go to the toilet any longer because they have severe pain when they pass urine, well, in these cases, it's very difficult and it's very likely that the disease comes back quite early. Whereas in contrast, if the diagnosis is made quite early in life, then we can better remove the lesions inside the body completely.
It is clearly a disease that affects the quality of life of a woman. Now,
yes.
Let's establish a bit how many days does it take to recover after such surgery? I'm talking about usually a woman coming from Romania to make her to make a trip out of it. You know, you said depending on the gravity of the situation, the operation can last for a few hours. How many days after the operation does she have to stay in the hospital?
Well, I give you an example. If a lady has typical symptoms, then she should come to Vienna for a preoperative counseling, for a preoperative checkup, gynecologic investigations, maybe additional investigations, ultrasonography, MRT, whatever might be necessary. So 2 days before the planned surgery, then she is admitted for surgery the same day, or maybe the day before, depends on what time of the day we do the surgery. If we do the surgery quite in the morning, ladies prefer to come the day before in the evening, then we do the surgery. If we speak from let's say an average case, then the operation takes around 1 hour, 1.5 hours. And in this situation, the patients stay for 2 nights in the hospital. It's wise afterwards to stay for a couple of days outside somewhere in Vienna. This is also a thing which we organize here from our hospital, because they're here around a lot of small hotels, pensions, and so on, where the ladies can stay another 2 or 3 days, and then they go back. So in summary, if we speak from an average case, it's wise to calculate with 1 week stay in Austria.
1 week is a small price to pay in terms of spending time in Vienna if you get this condition corrected, which certainly makes life very difficult for the ones suffering from it. Can we talk about the way endometriosis affects fertility, if it affects fertility, and when?
It quite often affects infertility. It's a little bit difficult maybe to explain, but what happens is, during ovulation, the egg enters the abdomen, the abdominal cavity, and gets in contact with the peritoneal fluid, which is the fluid which is inside the body to allow the bowel to move. And if there is endometriosis, this fluid is of different contents. it contains some hormones, and they interfere with getting pregnant.
Would you advise women to have their eggs frozen before the surgery in any way?
No, this is not a very, because usually we speak from young women. And as we spoke before, we do not remove ovaries. We try to preserve organs, even in endometriosis patients. This is what they need. They need their ovaries, they need their fallopian tubes, and they need their uterus. So whatever we do, we have to preserve their organs. And therefore, because we also preserve the ovaries on both sides, whenever possible, the best treatment is not frozen eggs, but IVF.
We were talking in the beginning about the laparoscopic surgery, that it is a good way to diagnose and also treat endometriosis. Can and when a hormonal treatment would be recommended?
First of all, as we said before, but we cannot repeat it often enough, first of all is the diagnosis. Laparoscopy, diagnosis, endometriosis. And then the treatment, the postoperative treatment or recommendation depends on what the lady expects. If she wants to get pregnant very soon, and for instance, she is 35 years old and she is a severe case of endometriosis, we would just for a small time advise hormonal treatment, and immediately afterwards, small time means 6 months, and immediately afterwards to go into an IVF treatment. If, on the other hand, it's a very young lady, the main symptom is pain, we are able to remove all the lesions during the laparoscopic operations, then maybe we would suggest not to have any further treatment, because we could remove all the lesions, and this is an expectant management without any treatment. Hormonal treatment always means, if it's successful, that we suppress more or less the ovaries. And if we suppress the ovaries, this does definitely interfere with the wish to conceive.
We were talking before about the fact that despite the surgery, endometriosis can occur at a later phase. It's not a one-time necessarily condition. Being a chronic disease, are there dangerous courses of endometriosis that can happen over time?
Well, another good question. Because endometriosis is not really, or the origin of the disease is not clearly known, we know that there are different types of endometriosis. Endometriosis can behave very different. There are some kinds of endometriosis, some types of endometriosis, they act really very aggressive. And they are able, in these cases, the lesions are able to invade other organs and can even behave like malignant diseases. Only malignant diseases can destroy other organs. They can grow into other organs. This is what we call metastasis in malignant diseases. But endometriosis in severe cases, in special types, can act even like that without being a malignant disease. Which means endometriosis can grow into the bladder, typically can, in very advanced cases, grow into the bowel and make very, very heavy symptoms, which in turn explains why, in these cases, we need what we call a multidisciplinary approach to treat the disease. We need surgeons. We operate together with surgeons if the bowel is affected or if the bladder is affected. We need the help of urologists.
And one last question, because I wouldn't want to take too much of your time. Our audience consists of many women here in Romania. Could you please say why generally is important for women who are affected to seek treatment in a specialized endometriosis center?
Because you must not only be able to operate certain early stages, but you must have a situation where you gather around yourself in the endometriosis center all different specialties. There are radiologists, there are surgeons, there are urologists involved, not only gynecologists, even if it's necessary, people need quite often in advanced stages psychological help. So we need also specialists in psychology or even in psychiatry, because it's in severe cases, this disease affects or can affect the social life of these ladies. They are unable to have sex. They stay at home. They avoid any contact to other people. They create their own small world in which they live with pain. And therefore, we need a multidisciplinary approach to help even such severe cases. And this is what we can only do in a specialized center.
Meaning a woman doesn't necessarily need just a medical attention, she also needs psychological care.
Exactly.
Okay, Professor, thank you so very much for being with us today. Sorin, îți predau ție legătura mai departe.
Vă mulțumesc pentru că ați urmărit acest webinar. La revedere și vă așteptăm la următoarele noastre evenimente.